actually, from my perspective, not always the treatment of something, it's the prevention of something. So what we should do is, by utilizing all the devices we have, is keeping us in a healthy state.
Hi and welcome to the new Weber Medical podcast. This is a new podcast where we explore the science and the stories behind regenerative medicine and light-based medicine. So we are focusing on photobiomodulation, or also called low-level laser therapy. We focus on photodynamic therapy, but also on other synergistic and holistic medical approaches. There's a big hype, especially on red light therapy right now in the biohacking and longevity field. And in this podcast, we want to discuss the science, clinical protocols that really work, and synergies with other therapies in the context of regenerative medicine. So today we are happy to have our first guest, a good friend and also a long-term business and research partner, Dr. Matthias Wojcik from Germany. He's the CEO of BSW Healthcare, also a very innovative German company working on highly bioavailable nutraceutical formulations like curcumin, green tea extract, boswellia, but there are many more. And those substances are nowadays used in many PBM or PDT protocols for treating chronic disease. And Dr. Wojcik, he's the leading expert. He's also related to the pharmacology department of the famous University of Marburg in Germany, where they did all the basic research and development of highly effective photosensitizers for photodynamic cancer therapy, but also for other applications. He's here today to explain a little bit the science behind photodynamic therapy, behind innovative nutraceutical formulations, and so welcome, Matthias.
Thank you very much.
Here today.
Hi, Robert.
And so let's get this conversation started. Maybe by you telling us a little bit about your scientific background, how your interest in those nutraceutical formulations started, the interest in photodynamic therapy with all your university background. So just tell us a little bit about your background.
Hi again, good morning, and thank you for having me. I'm also glad that we started this podcast, since we had this idea, I think, like half a year ago. And again, thank you for having me as your first guest. So I'm a typical pharmacist, educated in Germany, gone through a very typical pharmaceutical education in university, and then onboarded a PhD. And during my PhD, what I did is mainly formulating and trying to bring hardly soluble substances into very specific tissues or spaces in the body. And therefore we used mostly nanoscale delivery systems, nanoparticles, liposomes, different other structures, polyplexes and other things. And we use them mostly in cancer therapy. So because cancer tissue is very specific, and what we want to have is minimum adverse side effects out of the drug, and also help the drug really achieve the site of action. My professor is focusing in this therapeutic approach since many years and working with your father together onto a very specific treatment in cancer. It's called photodynamic therapy. There we use light devices to activate the substances. And therefore we have to be very specific, because when the substance is not in our tissue we want to activate, we achieve nothing. And out of this research we found that many nutraceuticals and many plant extracts lack the same purposes. So they are very badly soluble, they are not bioavailable for our body, they don't reach the effectiveness they could have. So what we did is translated this pharmaceutical technology, this formulation development into nutraceuticals, and created out of this a small nutraceutical company, which we are also then utilizing with your light devices in many different ways, also standalone for prevention, for also treatment, or for the possibility of having another potential application towards a certain tissue or a certain cell, like degenerative cells, microbia, or different other things.
Okay, so yeah, now you're already jumping a little bit forward, but just yeah, to get back to your university research, so you were the one working a lot on on showing the science of photodynamic therapy, how it's really working on a cellular level. So can you explain us a little bit what you did in the university research with those new formulations with cancer cells and checking or measuring the absorption of the substance into tissue and things like that?
So the thing is that most of our nowadays agent we use in cancer therapy, I see strength and limitation in this regard. So we have a quite nice I would say development into certain drugs, but they lack the variability. They have a very big adverse side effect potential, and therefore you just need pharmaceutical formulations to really create effectiveness throughout these agents, and also help them to get really into cancer cells, into certain tissues, and be taken up by our body. And out of this research, what we are trying there is really on a basic level show that on different type of cells and in cell lines, these pharmaceutical agents combined with our pharmaceutical formulation development are adding beneficial effects to them. And this is what I notice also natural compounds come into play, that you can utilize curcumin, for example, also in cancer therapy or as a anti-cancerous drugs to achieve different effectiveness, which are normally not achieved by powder formulations itself. So therefore, we transferred this technology. So where we are using what we see in university and try to transfer this onto different type of compounds, you are actually able to utilize it in clinics. And this is what we then can do by compounding pharmacies, for example, where they build up formulations we try to develop in university or did primary work. We publish everything in peer-reviewed journals. So we have also a very highly scientific background and like a viewpoint of it that this data is really reliable.
So, yeah, so in summary, in your university work, you have shown or proven, that those substances can be absorbed very effectively by the target tissue, that they can, selectively destroy cancer cells, for example. So, how do you see how does it translate into clinical practice? How do you rate, for example, the potential of photodynamic therapy in treating cancer, especially when you compare it to conventional therapies?
I think the biggest advantage nowadays is that we have just much more possibilities in creating devices which are capable of utilizing in a certain way photodynamic treatment. So, for example, in Germany, there is like approved cancer treatment for superficial cancer cells on the skin, which where you then utilize very specific patches with a photosensitizer called 5-LAA. And what you do afterwards, you just irradiate it with red light and kill specifically cancer cells, because cancer cells are very selective towards this agent and towards building up a certain structure you can activate by light devices. And from a point of view is that we lack just the possibility to bring the light inside or into or to the cancer tissue inside the body. This is nowadays done with your wearable devices, for example. So this is what we are also utilizing and what we are using in our publications. We always use the Weber laser as a device to really prove that activating substances through this device is working and is efficient towards cancer treatment and towards killing cancer cells. And I believe that this is somehow by the application and by the development of even more specific photosensitizers, the future of cancer therapy, because it's minimal invasive and it's also minimal due to side effects and other adverse effects you can have. So you have a very specific targeting of cancer tissue and cancer cells, and you just don't harm the rest of the body like normal traditional cancer therapeutics works, which are not so specific against cancer cells itself. And this is where I see the most biggest advantage. I believe also that the integrative approach we have, what we do in clinics, is the key to success. It's not only utilizing one certain technique, it's like thinking out of the box what we can combine. And that's why I am also not on the page of demonizing traditional pharmaceutical approaches. I believe it's adding everything we have and building a much more sufficient and effective system towards cancer as a disease itself.
Yes, I absolutely agree. So, let's stay a little bit with cancer. So, when we talk about such photosensitizer formulations and when you explain that they are very, specifically treating cancer cells, a big advantage that you don't have side effects like in other conventional modalities. Can you explain a little bit more how you're making those formulations, so specifically targeting the cancer cells? So, like you're using liposome technologies. Nowadays, we talk about exosome as carriers. Maybe you can explain a little bit how those carrier mechanisms are working.
So the main thing what we try to do is we really try to develop formulations which have the possibility to reach cancer cells or cancer tissue very specifically. So the uptake into a certain tissue, the solubility of the drug is improved, and this is the main thing what we have to take care about. So when you think about a injection, for example, we inject into the bloodstream, but in the bloodstream still there are plenty of other cells, there are plenty of different tissues, we have different pharmacodynamics, pharmacokinetics of certain drugs, and what we want really to achieve with our structures, nanoscale structures, in mainly really target this specific disease tissues or cells. So what we try to do with liposomes, for example, is prolong the circulation time of a drug, for example. So the ability of our formulation and of our carried drug to penetrate into a tissue and to accumulate in cells is higher. What we also do is with liposomal formulations, we have a much better uptake towards a cell than from a simple formulation itself or the substance itself, because they lack also different possibilities of being taken up by the cells, of elimination by the body, by our liver, by different metabolic systems. So this is what we are also trying to do. With exosomes, for example, we have now the possibility to have a very specific targeting mechanism, because an exosome is actually like a letter. It's brings this information inside a certain cell. It's built to bring this information to it. So this is a very natural system our body is using to really inform different cell types what they should do and what they are capable of doing by bringing also growth factors and different other molecules. And we are utilizing now or trying to utilize this exosome system because they have very specific targeting molecules towards cells to bring also our anti-cancer or photodynamic agents inside the cancer cell. And then you have the possibility of interacting with a Weber device, for example, to bring the light also specifically into this tissue. So where the light and the substance comes together, then you have a certain activity and you have actually a treatment or a working therapeutic approach where this both like things, the physical light and the pharmacological substance are not coming together, you have actually nothing. And this is where we can utilize very specific activities towards a very specific cell type and also a tissue. And this is making the treatment of, or like the approach of photodynamic therapy very effective and very strengthful. And we are overcoming several limitations we have by normal agents.
So let's get back to this integrative approach, because I think we are very much on the same page here. But let's say a clinician who is setting up integrative protocols for cancer management would reach out to you, or a patient would reach out to you asking you for advice. What would be the best integrative cancer protocol you would recommend to a patient or to a clinician?
I think the first step, what has to be done, is really creating a sufficient database we can rely on. So we have really to create data, what for a cancer type we have, what for different aspects of the cancer is there, what for, I would say data is just set there, what for experience is there for actually determining what for a cancer we have. And then out of this, we would create an option what we can do into adding photodynamic treatment and different other integrative protocols towards this treatment, like hyperthermia, for example, or if we need oxygenation of the tissue because the cancer is lacking a very specific oxygen component, we really have to utilize by photodynamic therapy. And I believe out of this, then we can create even additionally afterwards added treatments like stimulating the immune system to help the immune system afterwards find the necrosis, find the metastatic cancer cells, like released by the cancer tissue, we actually destroy to a certain component. We could add nutraceuticals, for example, to maintain a certain threshold of cancer cells or reduce this threshold of cancer cells into his body. So you have to see cancer in a certain way as a chronic disease. Once you develop this disease, you have to really take care of it each day from new. You have to maintain states where your body can handle it itself. And this is where I believe integrative treatment protocols with photobiomodulation, with stimulating, like I said, immune system, with adding oxygen therapies are really having their strength and then adding beneficial effects to it. And also maybe to mention, when we think about it, it's not only limited towards cancer treatment. It's also antimicrobial treatment, antiviral treatment, what we can do with photodynamic treatment therapy. Yeah. So what we can do also, we can bind substances directly to microbia, to parasites. This is what we also, maybe to mention, we did a study in Nigeria together, where we saw that riboflavin is specifically binding to the malaria parasite. And by only photodynamic treatment, we could reduce the parasite amount in the bloodstream faster than with HCCs and the standard therapy itself. So there are quite big potentials with the possibility of how we see formulations and how you build your devices to utilize real light.
Yeah, that's a very good point. Actually, it was one of my next questions, the topic of antimicrobial photodynamic therapy, because, as you just said, photodynamic therapy can not only be used for destroying or targeting cancer cells, but also for viruses, bacteria, or parasites. And this has been shown in multiple studies over the last couple of years. And I think it's also, a very exciting area of research right now.
Yeah, maybe something to add. During the Corona pandemic, there was a very big study done by a university in America where they infused riboflavin in blood transfusion bags and then irradiated it from outside with UV and blue light and could really specifically reduce the amount of viruses to zero actually. So these transfusion bags were safe to use and no blood component was destroyed through it. So you see that there is also a very specific targeting towards viruses. But actually what you really need is the utilization of a very specific formulation towards this type of structures, when I can call it, or microbials or viruses, actually like structures, like I said, and the utilization of light itself. Yeah, and this is where I see a big advantage in the combination of both of us and the techniques we just have.
Yeah, right. So, yeah, it has been proven to be very effective in acute infections. But I think also a very big topic is chronic infection, like, like Lyme disease or other chronic persistent virus diseases. So here, I guess we don't have a direct photodynamic action, but it has also been proven on a clinical level that it's effective by different mechanisms. So, what are your thoughts? Do you think it's also effective for treating chronic infection?
Yeah, it's always depending on what for chronic infections is and what is the cause of the chronic infection. But actually, if it's a virus or a bacteria, I think we have a very big range of possibilities to interact with this specific um, like structures or cell types or disease types. And there is, I believe, still much more research to be done because we now are in the beginning, I would say. In a certain way, I can see the devices we and the possibilities we are creating as a pioneering thing still, even if they are like developed since or researched since plenty of years, but they are still in a very preliminary state. And we are just moving towards what could be even more efficient, what for photosynthesizing agent could be even created. Now what we see is by utilizing ICG, for example, which can be utilized with infrared light, is a very big advantage because light is also determining, it's not only usage of the light, but also the wavelength determining how deeply we can penetrate into tissues. Is it even possible for us to stick needles somewhere? And this is where I see much more development just to be done now, and also much more groups being jumped onto this type of research, and also possibilities of creating even more highly effective lasers with I would say, more specific energy output towards a certain tissue. And this is where we just combine our forces quite well.
Yeah. So, yeah, now we talked a lot about photodynamic therapy, of how we can get rid of, like bad cells, like cancer cells or pathogens within the tissue. Let's move the topic a little bit towards the field of regenerative medicine, where we talk about photobiomodulation or low-level laser therapy. Maybe in a first step, because we are always throwing out those different terms, you can maybe explain or differentiate the terms of photodynamic therapy on the one hand, what we already talked about, and how it's different to the terms or mechanisms of photobiomodulation or just low-level laser therapy.
So when we speak about photodynamic treatment, we actually think about destroying something. So what we want to do is activate a substance by a certain light wavelength and then create singlet oxygen species or reactive oxygen species to destroy really cells or to interact with cells so they undergo apoptosis, for example, their own cell death. When we talk about photobiomodulation, what we do is we interact with certain specific systems, mainly in the mitochondria, where we activate certain complexes to achieve beneficial effects onto and out of the pathways which are activated by the mitochondria. For example, with red and infrared light, we activate or upregulate ATP production or nitrium oxide. With different other wavelengths, we activate different other complexes in the mitochondria. So we achieve other things, like with green light, we activate the hemoglobin binding sites. So there is a much better efficiency of binding hemoglobin or binding oxygen to hemoglobin. And this is where, so you can determine, or you can just divide them into a degenerative effect or like a destroying effect, and the photobiomodulation more as a regenerative effect, I would say. And this is the biggest advantage, and this is what you also have to take in account is many people think that activation of something is always beneficial. It is when you think about it very specifically, because in photodynamic treatment, it's a degenerative effect, so it's not beneficial towards regenerating or towards health itself. It's a really targeting effect of destroying something, and photobiomodulation is an activable effect towards a very specific system. And this is what you have really to determine or like to separate a bit of.
Yeah, thank you. I think that's very important to differentiate and understand those different terms. As you already said, photobiomodulation or low-level laser therapy is a very effective and also like a very promising tool right now in this field of longevity and biohacking. Everybody's talking about red light therapy, which is just basically narrowing the field just to red light. As we know, we can also use all the different wavelengths of light on a cellular level. We have good data showing stem cell activation or telomere activation and things like that for having anti-aging effects. So PBM is pretty effective in this field, but I think we are always looking for synergies. We are always looking for ways to enhance or improve our protocols. And I think good nutraceuticals play a very important role in this part. Maybe you can talk a little bit about the synergies of nutraceuticals and light therapies.
So in the end, we utilize a different approach towards the same effect we'd like to have. So what will you have with light devices? You have a physical effect onto a certain cell with a specific wavelength. And by adding nutraceuticals, what we have is a pharmacological or pharmacokinetic approach towards the cell types from an agent which is actually creating the same thing. So we have a very adding or beneficial effect or synergy between both. So it's not the activation of the substance, it's actually, when we think about Q10, we interact with the mitochondria, we strengthen the mitochondria, and this is what we do by a pharmacological drug substance and also by the addition of a physical approach, the light device. When we think about curcumin, for example, which is anti-inflammatory, which is directly blocking certain inflammation pathways. This is what you can also see by applying blue light, for example. So you have a physical effect onto the cell compartment, onto the cell pathways, and you have a pharmacological effect onto the same pathways. And this is synergizing and very beneficial and even creating much better outcomes than it would be when we would use only one approach on the same thing.
Yes, I agree. And now you already mentioned some of those very effective nutraceuticals you have developed or created. Maybe you can share some more on the substances you have developed, which you see as the most important or most promising natural nutraceuticals.
So maybe directly to get into the idea of curcumin, for example. It's a very very poorly soluble drug. So actually it's nearly not water soluble. And by not being soluble, your body has very big problems to take it up. And we have also a small limitation, or we have a system of making fat soluble drugs, what curcumin is, soluble, but only to a certain limit by our stomach, because we release certain agents and encapsulate them. This is how we take up fat lovely substances. But to really create an effectiveness by this compound. We need certain formulations, or there is a need of certain formulations. So what we do is, for curcumin, for example, we utilize liposomes. This encapsulate the curcumin, make it being secured by the stomach pH, and then being taken up by the intestine very well. For example, for anti-inflammatory purposes. What we can see also is, for example, for antioxidant purposes, we have a very nice drug in nature which is called astaxanthin. It's a red algae, which is also hardly water soluble, and what we then use different formulation approaches. We use mainly liposomes because they are natural, they are recognized quite well by the body, they are biocompatible, so you can use them nicely in pharmaceutical nutraceutical formulations to achieve high bioavailability and utilize the substances. We can see also, for example, like I explained, coexune Cum10, or we use the very well-known agent in Germany. It's called frankincense, which is also very nice anti-inflammation purposes. And this is where we just utilize a very natural system our budget gave us, but from a pharmaceutical grade, to even develop more effective natural compounds which were used over thousands of years by humanity.
Yes, and you created those tools, I guess, especially for home use, so patients can use it on a daily level, also maybe in combination with home use light devices to make it more effective. Or what do you recommend as a perfect home care protocol for patients?
So this is what I see is quite limiting also therapeutic approaches by clinics. So you go to a clinic, you get an infusion, you hire the plasma levels of a thing, you get to a certain steady state, and then the patient's actually released to go home. And then you just, when they come back, like after 4 weeks or something like this, you just start from a 0 point again, because they are not maintaining what you gave them and what you tried to do with them, and they are not maintaining your therapeutic scheme somehow. And I believe that's when nutraceuticals and devices like the Weber watch come into play, where you can just utilize the same things you have in the clinic on a little bit, I would say, somehow less effective basis, because infusion will be always better than a supplementation by oral uptake, or a intravenous photobiomodulation approach will be always more effective than an external photobiomodulation device. But what you do is you actually maintain the therapeutic concept you did in your clinic to interact with a certain disease approach, therapeutic concept. And this is what I believe is still missing in our normal daily basis in treating patients and giving them a helping hand. And this is where I see then home use devices, for example, like the Weber watch, for example, for inflammation directly. When we speak about it and when you want to have a therapeutic concept, I believe that an infusion with curcumin is quite nice. Then adding photobiomodulation to decrease the inflammatory markers, the inflammation itself on a very high basis, and then maintain this anti-inflammatory aspects by utilizing the Weber watch on a daily basis and adding curcumin on a daily basis as a drink. And this is where I see still being missed out in taking care of this type of patients and giving them the ability of actually doing the same thing you did in a clinic. And this is where I believe also awareness is created towards what a patient should take care of. And this is mainly for themselves. And this is where I see possibilities still being able to be utilized.
Yeah, I absolutely agree. And yeah, that's actually one of the reasons why we made those developments for home use, to give patients really the opportunity to also take care of their health by their own hands. And yeah, in this context, last topic for today, I would say, is this whole area of brain health. As you know, we are also developing right now or are close to launch this new product where we can treat or regenerate the brain by red and infrared light, this so-called transcranial photobiomodulation. So yeah, what are your thoughts on the potential of this therapeutic approach? And maybe you also have some ideas on synergistic protocols with specific nutraceuticals?
Yeah, I think this field is quite funny because the scientific database and background towards the transcranial treatment with infrared and red light is very intensively like researched, but the utilization of it is still on a very small basis, and this is where I believe the biggest development could be done. You know that you have actually now, from your type of practice, what you created is a laser device towards it, a possibility of utilize and to use the data created to really help patients with this type of disorders. Because mental health is a very big aspect of your overall health. And I believe when we miss out this ability of interact also with mental like disorders or diseases, we just miss out the potential of actually helping with every other disease. And by the ability of utilizing both, for example, also ECGC is a very nice substance which is capable of penetrating the blood-brain barrier, or even frankincense. We have again the ability of having a physical effect onto different type of brain cells, activate the mitochondria, activate microcirculation, and then help with the pharmacological side with ECGC or frankincense to actually create even more beneficial effects. So yeah, I like the idea what you did there with your new device, and I believe there is plenty work to be done for us, even with this type of things and approaches. And there will be a very nice addition towards helping really patients with mental disorders. And this is also one of the I'll call this the genres or fields we have in diseases which are growing very rapidly in our normal society and community nowadays. And this is yeah, a very, very nice perspective for all the people suffering.
Yes, I agree. I think focusing on maintaining or improving brain health is one of the yeah key topics for the future when we talk about regenerative medicine. And this would be also actually my last question for you. So, where would you see the future of regenerative medicine? What are the most important things for you, yeah, for future development and for research?
I think it's really the integration of different aspects of medical or preventive treatments. It's not missing out something, it's not demonizing a thing, it's really thinking out of the box and taking everything we have and not trying to destroy an idea which we actually are not capable of understand in the first place nowadays. And AI will give us even more abilities of really overcoming this type of things, I believe, and it will be even a far more fast-paced approach towards it. But I believe that integration of different protocols, different devices, different technologies, and also perspectives towards what we should do is the key aspect. And also, when we think about it, it's actually, from my perspective, not always the treatment of something, it's the prevention of something. So what we should do is, by utilizing all the devices we have, is keeping us in a healthy state. And I had the discussion once on one of your conferences, if we are healthy or if we are always ill. And I still believe, I'm more optimistic that we are born to be healthy and not born to be ill and just to try to cure something. It's about our body is smart enough, and what we have to do is just giving him the tools and the abilities by aging, because it's like reducing certain effects we have, certain affectionedness. Our body is just giving us immune system stimulation, everything like this to maintain what we are gifted. And this is health.
Thank you. I think it was a very good summary. And again, what we are always coming back to is this idea of having very good integrative protocols. I think that's the key. We are not saying like, I'm the expert on laser therapy, that's the magic bullet. You are the expert on nutraceuticals, but actually that's the idea of this podcast, to bring together as many experts as possible from different fields of regenerative medicine to really create or discuss the most effective synergies and protocols in this field of regenerative medicine, but also for treating chronic disease like cancer. And so I think it was a good first episode. So thank you again, Matthias. Maybe
Thank
you
you
want
very
to
much.
share, like for people who are interested in your work, your social media, your website, upcoming events, or whatever you would like to share. Now is the opportunity.
Yeah, I would be happy to see more people on our conferences. We are doing, maybe to mention one together, always in the US in the springtime. And then we are always also on the different other conferences trying to speak, trying to explain people our devices, having booths there like the A4M, for example, in December this year. So I believe I would be happy to see more of of the listeners there, and to explain what we are doing, and to get into exchange with them, to even have the opportunity to create even better ideas or even more ideas out of different other synergies. Maybe we miss out like a step what we could also add towards it. And if people want to see what we are doing, we have a small homepage which is called biosomo.com. You can find me also on Instagram at biosomo.com or at biosomo. And like I said, you can also find me on all the Weber conferences, and I'd be happy to see all you around there, and to discuss and opportunities with you and to talk about health.
Yeah, thank you. Actually, we will be back to the US at the AAMP conference in October. And of course, we will also be at A4M in Las Vegas. And this is always a great opportunity to meet and connect, and also see our products, discuss our protocols. And we are always happy to meet all of you who are interested in this field of regenerative medicine or photobiomodulation. Yeah, and if you enjoyed this first podcast episode, please feel free to share it with someone who would benefit. I think it's great content for patients, but also for clinicians. And you can follow us in the future on YouTube, Spotify, check for other episodes. And of course, you're always invited to reach out to us for discussing protocols or for whatever questions you might have. So, thank you very much.
Thank you once again.